Hello and congratulations on the birth of your baby. I'm Dr. Louise Chu, a board-certified OBGYN here at Northwell's Lenox Hospital.
I am Patricia Donovan, pediatric board-certified hospital of medicine here at Lenox Hospital.
Leaving the hospital can be both exciting and overwhelming. That is completely normal. The next few days and weeks are full of healing, learning, and adjustments. You're not expected to know everything right away.
And remember, babies are resilient. You're doing better than you think. We're here to walk you through the things you need to learn when you bring your baby home.
Let's start by taking care of yourself. Whether you've had a vaginal delivery or a cesarean section, it takes time to heal. We're here to give you some tips to guide you through the postpartum period. If you've had a vaginal delivery, you may be bleeding and have discharge called lochia for the next 6 weeks. The bleeding starts bright red, turns pink, brown, and then yellowish white. On day 10, most patients will experience heavier bleeding, and that is completely normal. However, if the bleeding becomes heavy, soaking more than a pad in 1 hour, you should call your provider. Keep the area clean with warm water and dry by changing pads regularly. Avoid placing anything in the vagina, including douching and of course intercourse, until your doctor gives you the clearance. You may use ice packs and witch hazel pads to help soothe the area in the first week. Cesarean delivery may require a little bit longer, up to 8 weeks. You should avoid strenuous exercise and lifting anything heavy, which is defined usually as anything more than 10 pounds. You want to keep your incision clean and dry by patting gently dry after showers. You may also take a blow dryer on cool and dry that area afterwards. You want to look out for signs of infection, which may include redness, fever, and oozing and bleeding. You should stay active with gentle walks, which may help with digestion and also prevent blood clots. Before you leave the hospital, you may be recommended to take some pain medications such as ibuprofen, acetaminophen, and even oxycodone, especially if you've had a cesarean section. You may also want to continue stool softeners. We also recommend that you continue your prenatal vitamins or postnatal vitamins at home. As a new parent, sometimes we forget to take care of ourselves. We want to focus on a well-balanced diet full of proteins, vegetables, fruits, and whole grains. Stay hydrated, especially if you're breastfeeding. You want to take in at least 8 to 10 glasses of water, and always remember extra fiber in your diet, as this can help with constipation. If you're breastfeeding or pumping, you may require 300 to 500 extra calories a day, plus twice the amount of calcium you have taken during the pregnancy. Many breastfeeding moms experience night sweats, and this is completely normal. This is due to hormones and the production of milk from the breast. So remember, breastfeeding takes extra calories, rest, and hydration. So listen to your body. Some new moms may experience incontinence, which is trouble holding your urine. You should talk to your provider if you're experiencing these symptoms. Your provider may suggest pelvic floor therapy or even teach you how to perform Kegel exercises, which are a way to strengthen your pelvic floor muscles. You should call your doctor if you're having fever, which is defined as over 100.4 Fahrenheit. You should call if you have heavy vaginal bleeding, which again is defined as soaking a pad in less than 1 hour. You should call if you're having swelling, abdominal pain, and any sort of leg pain, any sort of redness and pain in the perineal area or in the incision site. You may also be experiencing emotional changes. If you're experiencing extreme anxiety and sadness that feels uncontrollable, that is also something to call your provider about.
So now that you've learned everything about taking care of yourself, let's talk about taking care of your baby. Whether you're breastfeeding or formula feeding, it's recommended that a baby feeds every 2 to 3 hours. Initially, the size of the stomach of the baby is the size of a cherry. Small amounts are okay, so don't worry. We'll be weighing your baby every day. It's okay for them to lose weight. They'll regain it back once they start feeding larger amounts, and your pediatrician will monitor the weight gain. Mastitis can happen whether or not you breastfeed. If you feel discomfort, pain, redness, swelling, or fever, please contact your OB provider for further recommendations. Initially, babies will have 1 to 2 diapers per day, but as your baby gets older, you'll see an increase in wet diapers and soiled diapers. The easy rule of thumb, the wet diapers matches the days of life, so day of life 1, you'll have 1 to 2, moving along up to 7 days, then you will have 7 to 8 wet diapers. circumcision. For the first 24 hours after the circumcision is performed, we'd like you to apply petroleum jelly on a gauze and apply it on top of the penis, pointing outwards. Usually we recommend it until the penis turns pink and is healing. Please contact your pediatrician if you notice excessive bleeding, odor, pus, or swelling. Do not retract the foreskin on an uncircumcised penis. Bathing. We don't recommend a submersive bath until the cord falls off, which happens about 1 to 2 weeks after you leave the hospital. In the meantime, we do recommend sponge baths in the areas that are most needed. Sleep. Infants sleep a lot. The American Academy of Pediatrics does recommend the ABCs: alone, on their back, and their crib. Always place your baby on a flat, firm surface. Avoid blankets, toys, or anything around the face of the baby. Crying is normal. That's how babies communicate with us. You will learn different cues and different cries once you take your baby home. Now let's talk about car seat safety. Always place your infant in the back of the car, rear facing, with a 5-point harness with every ride home.
Don't forget to make an appointment with your OBGYN within the next 6 weeks. Sooner if you had a C-section or any complications during the delivery.
And you need to see your pediatrician within 1 to 3 days after leaving the hospital. We gave you a discharge summary to bring to your pediatrician visit.
You're not alone when you leave the hospital. We gave you printed instructions and our care team is just a phone call away.
For more information, please visit our website, Lenox Hill Center for Family Education.
This is a big transition, but you've got this. Be kind to yourself, take things one day at a time, and ask for help when needed.
From all of us here at Lenox Hill Northwell, congratulations and welcome to parenthood.